Hi, my name is Amanda McIntyre, and I will be presenting predictors of depression among patients with chronic pain. So chronic pain is different from acute pain in that it continues beyond the 6-month mark. It affects a significant proportion of the Canadian population, nearly 20% of the population. And it's very complex, characterized by high levels of pain, in combination with significant disability and a high degree of psychological and social comorbidity. So in the transition from acute to chronic pain, it's been shown to be predicted by variables including higher pain intensity, greater anxiety and distress, less certainty among individuals that pain would resolve, longer hospitalization and less independence in ambulation, as well as a diagnosis of trauma and lack of need for surgery. So chronic pain often is so debilitating that it leads to depression. There's high rates of depression, and this is predicted among the chronic pain population by pain severity, multimorbidity, so a greater number of chronic diseases experienced, as well as underlying anxiety, pain interference with activities of daily living, and cognitive distortion, which is the way in which an individual perceives their symptomology, the impact of their chronic pain, treatment, and control over their pain. So in light of this significant amount of research in this area, really the role or the objective of this study was to explore the role of personality traits, coping strategies, as well as anxiety, substance use, and quality of life, and the way in which it predicts depression among individuals with chronic pain. So we used a cross-sectional exploratory study. After receiving ethics approval, we recruited patients at Parkwood and St. Joseph's chronic pain outpatient clinics. We recruited adults who were at least 18 years old, diagnosed with chronic pain for at least 3 months. They had to have been receiving pharmacological treatment, a minimum pain intensity of 3 out of 10, and able to read and write in English. We collected sociodemographic information and clinical health information, and participants completed several validated outcome measures on depressive symptoms, anxiety symptoms, pain severity and interference, as well as 2 personality traits, anxiety sensitivity and experiential avoidance. We also evaluated quality of life and substance misuse. We had 155 individuals with complete data sets, including 109 females and 46 females. 69, nearly 70% were unemployed. There was a fairly even distribution in level of education achieved. They were quite far from their original injury or event that had caused the chronic pain, about 14 years. About half of the individuals had mixed pain, and a third of individuals did not use opioid analgesics, and nearly 70% did not use cannabinoids. So we found that our model generated 6 predictors, accounting for a significant amount of variance in the outcome PHQ-9, which is the Patient Health Questionnaire-9 item, which evaluates depressive symptoms. So we found that the General Anxiety Disorder outcome measure, which evaluates anxiety symptoms, pain interference, anxiety sensitivity, employment, dysfunctional coping, and opioid level were all predictive of depressive symptoms in this population. So as we indicated earlier, the research has evaluated several of these variables, and so our findings are corroborated by previous evidence showing that anxiety, pain interference, and opioid dosing is related to depression and chronic pain. However, our study also has added to the literature in that we found that dysfunctional maladaptive coping, as well as anxiety sensitivity, also predicts depressive symptoms in chronic pain. And these variables should be screened, and individuals should be provided intervention early on among this chronic pain group. Thank you.